ever looked at an NCLEX question and thought, wait, all of these questions look right? That's not a mistake. That's the NCLEX testing your clinical judgment. The exam isn't just checking what you remember, it's checking how you think. So today, we're going to break down exactly how the NCLEX thinks through the NCSBN Clinical Judgment Model and how you can start thinking the same way. Hi, I'm Tracy from NurseEdScholar, and today I'll help you understand how the NCLEX actually thinks. So let's get started. So the NCSBN Clinical Judgment Measurement Model, or the CJMM, is the foundation of the next generation NCLEX. It describes the thought processes nurses use and that the NCLEX now measures. So, when they're making safe, effective decisions at the bedside. And so this model has 6 layers. So think of it like a chain reaction of critical thinking. So number one is recognizing cues. With that, you're noticing any new, abnormal, or concerning concerns in the data, right? Number two, you're analyzing cues. You're connecting the dots to figure out what's really going on with your patient. Number three, prioritize hypotheses, deciding which possible problem is the most urgent. Number four, generate solutions, determining what you can do about it. Number five, take an action, implement the safest, most effective intervention. And number six, evaluate your outcomes, checking if what you actually did worked. So look at it. Each step flows into the next. And the NCLEX is built to test how well you move through these steps under pressure. You're not just recalling, you're reasoning. The NCLEX wants to see if you can recognize red flags, act safely, and prove that your interventions work. So think of yourself like a clinical detective. You walk into a patient's room, and your job is to collect clues, or what we call cues, that tell you what's happening beneath the surface. As a detective, you know, they just don't see a footprint. They ask which direction is the footprint facing, who fits the shoe, what does all of this mean? So as a nurse, when a patient has new shortness of breath, pale skin, and a drop in blood pressure, those are your clues. Okay? A detective doesn't just jump to conclusion. They gather, compare, and analyze the data. And that's exactly how you should approach the NCLEX. One clue at a time, eliminating distractions until you find the root cause. So one of the best ways that you can train your brain to this is to use what I call, or what's called, Socratic thinking. Asking yourself questions before jumping to an answer. So examples are, what's the most concerning finding? Is this new, worsening, or expected for this condition? If I only fix one thing, which one prevents the patient from crashing, from getting worse? And what data am I missing that can confirm my suspicion of what's going on? So let's take an example. A patient recovering from surgery suddenly becomes confused and restless. Ask yourself, is this expected? No, just came out of surgery. Um, is it new? Yes, because preoperatively, patient probably wasn't confused or restless, right? So it's new. So what could it cause? It could be caused by, so possibly hypoxia. So that one question tells you that it's an oxygenation issue. It's your A and ABCs, okay? Airway, breathing, and circulation. And it's most likely the urgent priority, okay? So let's look at it in a mini challenge. So you're caring for a 68-year-old patient admitted for pneumonia. The nurse aide reports that the patient, who was alert this morning, is now drowsy and hard to arouse. So your vital signs are 101.3 temp, 110 heart rate, 28 respirations, 94/58 blood pressure, and their SpO2 is 86% on 2 liters per nasal cannula. So, what's the most concerning cue? And what's your priority goal? Right? So, let's think through it. You recognize the cues: decreased alertness, SpO2 86%, respirations 28. So, there's some respiratory compromise. Analyze cues: oxygen not improving despite the O2. So that shows an early sign of worsening pneumonia or sepsis. Number three, prioritize hypotheses. There's some impaired gas exchange leading to hypoxia. Generate solutions. You increase the O2 per protocol, elevate the head of the bed, call the provider, prepare for advanced support. You take action. You reassess the SpO2 after the intervention. And number six, you evaluate your outcome. Did the oxygen improve? Is alertness returning? So the most concerning cue is the drop in oxygenation with altered mental status because it signals that oxygen is not reaching the brain. That's your detective clue, leading you to your priority goal, restoring oxygenation and preventing deterioration. So let's wrap it up. So the next time you face an NCLEX question, slow down and think like a detective. Look for cues, ask the right questions, identify what's new, what's worsening, and what truly is life threatening. The NCLEX is not trying to trick you, it's just asking, can you think like a nurse? So if this has helped, go ahead and like, subscribe, and hit that notification bell so you don't miss the next lesson in this series. And if you want to practice these steps in depth, download the full clinical judgment and prioritization workbook at NurseEdScholar.com. It's packed with case studies, Socratic prompts, and NCLEX style mini quizzes to help you master this model. And remember, every question is a clue. You just have to think like a nurse and test like a pro. I hope you've enjoyed this video today. Please come back. I'll have number 2 in the series coming up. And until next time, happy studying, happy learning. Good luck in school.